new guidelines that the CDC has released as to when and how we get back. We've got Dr. Devi Nampiaparampil, who joins us on all of this. Doctor, one of the things they immediately start talking about is how workers will have their temperatures checked. They're free to, in fact, often advised to wear face masks, keep the social distancing thing going. How do you think all of this is going to go?
Well, I think that taking those precautionary measures is good. The part that's concerning to me about the CDC guidelines is that they've sort of artificially separated people into two groups, the general public versus those working in essential fields. So what they're talking about is people who have had a known exposure to coronavirus. So those are folks who normally we ask them to stay home and quarantine for 14 days. But in this case, they're being told if they're essential workers, that they should instead still continue to go to work and take those precautions. And that's troubling because the CDC is separating these two folks, but the virus really doesn't differentiate between those two groups.
What if you're asymptomatic? You know, there's nothing to indicate that you might have it.
You're right. So right now, we know that about 50% of people have a fever, but not 100%. So checking the temperature can be helpful if you find someone who has a fever, but it's not that helpful if they don't. If they have no other symptoms, sure, it could be that they don't have coronavirus or any other illness, but a lot of the carriers are asymptomatic. And some studies are arguing that maybe 80% of people are asymptomatic. So it's tricky because I understand why the CDC did this. We need essential workers. We need the food chain to be preserved and the pharmacy chain, healthcare workers, first responders. But the problem is that all of this sort of erodes the public's trust, right? Because is the CDC trying to protect these employees, trying to protect the companies, creates conflict. I mean, things can evolve, guidelines can change when you have new research or new data coming out and thinking changes. But in this case, our understanding of the virus hasn't changed from that perspective. It's just that we want to maintain these industries.
All right, doctor, thank you very, very much. I get scared when I hear right away I'm going to walk into my building or whatever. They're immediately going to take my temperature. They're going to be handing out face masks. I don't know if it's scarier or not when we eventually do get back to life as usual, whatever that is these days. There are a lot of people doing a lot of incredible things in the face of all of this. The doctor we just talked to is among them. But a lot of stars and celebrities are doing things. Noted germaphobe Howie Mandel will be joining us. He is attacking this problem head on in ways you might not think.